Alright, so electronic health records are a digital version of a patient's paper chart. They make it easier for everyone to be better informed and more involved in a patient's healthcare. It's also a great way to access and edit a patient's health information quickly. However, a lot of people have questions and concerns about the privacy of their health information. HIPAA, as we all know, is the Health Insurance Portability and Accountability Act that protects the privacy of a patient's health information. Specific to electronic health records, HIPAA requires that healthcare providers set up safeguards to protect the electronic health information of all patients. Some of these safety measures include access controls such as passwords, PIN numbers, and badge recognition, encrypting stored information, which means that in order to read someone's health information, a special key made available only to authorized individuals must be pressed to decrypt the information, and an audit trail that allows the hospital to keep record of who accessed the information, what specifically did that person look at, and if any changes were made. If for any reason a patient's health information is seen by someone who wasn't supposed to see it, the hospital is required by law to notify the affected patient of a breach of their health information. One of the main concerns of electronic health records is that a lot of times healthcare professionals forget to log out and leave. This allows any random person to find and read health information about any patient.
Hi guys, I'm going to be talking about the EHR hardware, which can be confusing if you're not in the computer world. So here I have a nice little chart that kind of shows different examples of hardware. This includes scanners, storage, medical devices, workstations, servers, laptops, smartphones, monitors, printers, the whole shebang. So the desktops are more designed for the fixed location. They can be like the nurse's station, registration, billing, triage, the exam room. Laptops are more portable. They're designed for like mobility and space conservation. So a lot of physicians choose to use these, and then we also have the tablets that are also portable, mobile, space conservation even to an extreme level because they're super tiny. And physicians usually choose to use these as well. More on the server end, this can be, a simple definition is that it's a computer that serves other computers on a network. So we have the application server, which the computer is the computer with the EHR application. The database server, which is the computer which the database software resides on. You have the Citrix or terminal server, which is the computer that supports the thin client network. So all this stuff can be kind of expensive, so this is why bigger hospitals have more resources and money to spend on this stuff, which can be a disadvantage for the smaller hospitals.
I'm going to be talking about software for your electronic health record. When you're choosing an appropriate and effective software for EHR, it is not an easy task and should be done with much consideration. So the first and best approach begins with an EHR certified practice management software system. And so when you choose the software, one should always follow the 4 standards that have been known to raise the bar in the EHR industry. And so the first is improvement of patient care, meaning that clinical decision support rules are a requirement of an electronic health record in an effort to help improve patient care through alerts based on specific indicators in the patient's health records. Another standard is reduction in drug-to-drug and drug allergy interactions. These checks are mandatory for providers practicing meaningful use. With e-prescribing and electronic medication lists, doctors can now prevent interactions in a collective effort. The third one is decreased costs, and another standard when choosing an EHR software. Being able to show clinical necessity based on closely defined quality measures can help decrease costs in certain treatments. Also, since the software should be under a certified label, it ensures that the software chosen has passed governmental guidelines, functions in consideration as a complete EHR. The final standard when choosing the software is improved probability of patient records, meaning that it's easier for the patient to collectively acquire their health records. If they are seeing multiple providers or getting treatment at a number of facilities, it is potentially life-saving because it can decrease the time it takes to get a diagnosis, lab tests, and potential drug interactions.
So I'm going to be talking about data elements. Data elements are one of the core components to any health record, including electronic health records. So a data element is a single factor measurement, such as age, gender, or blood pressure. In the healthcare settings, data is stored in an electronic health record, which are then combined, analyzed, and interpreted by clinicians. For example, a patient's symptom report, lab results, and observations made by the physician are combined to form a big clinical picture. Electronic health records use controlled vocabulary instead of narrative text because structured data is necessary to collect and transmit efficient information. So, of course, our goal with the electronic health record is to achieve a state of complete and accurate electronic charting for every patient. But here are some concerns with the EHR. So the historic lack of structured data and standardization in the healthcare industry today causes problems when sharing EHR content between providers. For example, data element coding may be inconsistent between software programs or health systems, and uncontrolled vocabulary can cause similar issues. So here are a couple possible solutions. To institute a clinical standards committee to develop policies and standard clinical protocols and electronic health record standards, and to identify workflow to facilitate data entry to streamline the data capturing, which I kind of like to think of as like the ergonomics of data in the healthcare setting.
Okay, so some advantages of the EHR are increased revenue, which is seen through improved charge capture and decrease in billing errors, improved cash flow, and enhanced revenue. We also have some inverted costs, which is the result of efficiencies created by having the patient information electronically available. So these include increased utilization of tests, reduced staff resources devoted to a patient management, reduced costs relating to supplies needed to maintain the paper files, decreased transcription costs, and the costs relating to the chart pools. We also have a reduction in errors in general, and because it's electronic, it's more legible, so you have less medication errors and less documentation errors. Other benefits that are less tangible include improved legal and regulatory compliance, and with the broader documentation, it is easier to access for if you're going to court. There's also improved ability to conduct research, and there's increased job satisfaction among physicians, which is super cool.